So we have applied to our treatment services, and I was left again. And we are expecting to hear back soon, very soon. And some clinics have been, obviously in the HFEA, have been very efficient and turning this round sometimes within a day. So we have submitted our applications for all our main clinics to reopen and offer treatment services, submitted today. So hopefully tomorrow, this week, we are expecting to have the good news and the green light. Satellite clinics may take a little bit longer, but as they're linked closely to us, there shouldn't be too much of a delay. The estimated time frame then, so if we optimistically assume that we'll hear this week, later this week at the latest, early next week, then we should be in a position to start seeing patients next week. Will there be different start times for private and NHS patients? Not necessarily. What we are going to do, and we have been in touch with patients who were already in the system who were waiting for treatments when we had to close down. So some of them will be poised to get started straight away. We've been working very hard to make sure that those patients are treatment ready. And patients who've been in touch during the close down are treatment ready as they can be. So we've been doing Skype and virtual consultations, and those can continue, and we will still be offering those. We've been working with the men to drop their samples off, the semen samples, for analysis, rather than come into the clinic to produce the sample. So we've got a nice system working to do that. We've been undertaking AMH testing from home. We've sent kits out to our patients to do that. We've been issuing protocols, clinical protocols online. We've been doing consents virtually through our patient portal. So there are lots of things in place that can help patients get treatment ready. And these methods are still going to be continuing, because we are going to try and minimise the number of patient visits into our clinics. So yes, patients can get their medication if they have the protocol and they've contacted the clinics and have been told to get started. So we are waiting for this green light from the HFEA, our regulator, to allow us to resume fertility treatment services. But we can do a lot of stuff to get organised, get the protocols out, and get consent signed, and really get in shape so we can be starting as soon as patients are ready. Fresh or frozen embryo treatment cycles, there's no reason for us to believe that we're going to be limited into which treatments we can offer. The most important point here is we have to demonstrate that we can offer treatments safely, and we're not looking at individual treatments to say this is more safe than that one. We're going to try and offer all of our treatment services as safely as possible, considering individual patient risk factors. And I'm just going to try one more time to get Mark in. So we'll be considering individual patient risk factors. Obviously, some patients are more vulnerable at this time than others, so those things will be considered. And we'll talk to you on a case-by-case basis, of course, about all of those things. So when will the doctors, there's a question here, when will the doctors be coming back from furlough? So we're starting to bring our staff back already now. And yeah, we're bringing staff back, all staff that we need back are starting to come back next week, and we can adapt to demand. So we've got a very strategic plan so that we know that we can offer the services that we need to offer, and we've got the staff there. And of course, being part of a group, we have this added flexibility because there are concerns, and certainly in our our self-assessment questionnaire for the regulator, there is a concern that if staff are unwell or unable to work, can clinics still offer the services? So because we have a large group, have a very large team, then we can support each other, and our staff are very flexible. We often send our embryologists, our scientists, round to work in other settings, so that's just one example of how we can do that. So more questions coming up here. What measures are you putting in place to make sure patients and staff stay safe? And we'll be running on a lower staff numbers. So we have been looking at the layout of the clinic. So we've made sure we've got spacing in between waiting areas, between consultation desks. So we've considered every space within the clinic and incorporated safe distances, personal protective equipment. So we have really considered how we can keep patients safe. We're having a code of conduct so that staff know what's expected of them, no patients know what's expected of them, so that we can keep each other safe. We'll be looking at testing patients, triaging them, doing a questionnaire with them to make sure they don't have any symptoms, and just to make sure people are feeling well before they start to undergo their fertility treatment. Fertility tests, another question here. We're waiting for some blood tests. So we have systems in place so that we can undertake blood testing, and we can undertake ultrasonography, so the ultrasound scan that's very important during the monitoring phase of the stimulation. So all of these things have been considered, and our staff will talk you through what you will expect, what you can see when you come into clinics, how it will look different, and how your treatment may be different to a treatment that you've had in the past. But fundamentally, the procedures will be the same, with the personal protective equipment and distancing where possible, and we'll be minimising the number of staff in each area and patients in each area. So we may be extending the working day in some of our clinics. We may be asking you to wait in your car until it's time for your appointment, until we're ready to see you, to come in, rather than sit together in the waiting room. So common sense approach really is what we're doing in terms of social distancing. Very clear signage, very clear written documentation and information for patients, so that we all know exactly what's expected of us, and we can do this as safely as possible. So we've got a patient, Ms. Thompson, cycle's due on Friday. I'm waiting for frozen embryo transfer. Could I have my meds to start on Friday? I guess that is possible. It very much depends on if we get the green light from the HFEA before Friday. Quietly optimistic that we may do. So I would contact your clinic straight away, really, and talk to them about what they think is possible. Right, some more questions here. Let's see. We've got fresh and frozen. So I'll just talk briefly about that, because there have been some discussions and lots of questions about whether frozen transfer is safer than a fresh. So clearly you can't have a frozen embryo transfer straight away unless you've undergone a fresh treatment cycle and had those embryos frozen. So there will be fresh treatment cycles conducted, and we anticipate that most patients, if they wish and if our team believe they're safe to have a fresh transfer, then we will do a fresh transfer. Most commonly, this will be a single embryo transfer. We always want to reduce the risk of multiple pregnancy, and we will be making assessments to make sure we consider that the risk of ovarian hyperstimulation syndrome, so one of the greatest risks of IVF, this syndrome, we're going to be assessing to make sure that risk is very, very low. If we believe there's a realistic risk of that syndrome, then we would suggest and freeze the embryos. So there's no reason to consider, unless there are particular risk factors, why we wouldn't proceed with a fresh transfer. So frozen transfers are quicker to organise. So the expectation is that over the next few weeks, when we get the green light, then we will probably start with frozen embryos, because we are more ready to start with the frozen embryos, because there's a shorter lead time, generally speaking, than with a fresh treatment cycle where we need to undertake this stimulation phase. So the fresh treatment cycles may be a couple of weeks away, but as soon as we get the authorization to proceed with treatments, then we can start that process, hopefully as soon as next week. Some questions about NHS funding and privately funded patients. So this is a difficult question, because it very much depends on the area, the CCG, so where the funding is coming from, the geographical location, and the terms around that NHS funding. But our clinics are able to offer NHS treatment cycles if we receive a referral. So, yeah, we can do that. And there is a possibility that some NHS clinics may be a little bit slower to reopen, not because they're not as slick and efficient, but because that some of their staff may have been redeployed, or some of the space within the NHS clinics may have been used during the this coronavirus pandemic. So I would suggest you contact your clinic and discuss with them and help make a decision based on that. Donation, I can talk to you about. There's a question here from Emma, I think. Emma, so when are we going to start matching sperm again? Okay, so our lovely sperm matching department is now reopened. We brought them back from furlough this week, so that will start straight away. Similarly with egg donation matching, our donation team are poised to get started as well with donor matching for eggs. So that's all good. We have a very extensive now donor egg bank. So we're really pleased. We've worked very hard, and we've got lots of donor eggs from wonderful egg donors that we've been banking over the last 6 to 12 months or so, and they're ready for matching. So what you need to do in terms of contact, if you are an existing patient and you were in the system, then our clinics should have been in touch with you by now through your portal with information about where we're up to and what your next steps may be, and also how you can get treatment ready. If you haven't heard from us in that, then of course get in touch with our teams, either your local clinic directly, or we have a general inquiry management team, GEM, and they'll be able to help you and divert your call and advise. If you're a brand new patient, same thing. If you want to contact your local care clinic, that would be great. We'll help you as much as we can. There may be a short wait for answering the phone. I'm sure we're very busy at the minute, and we're still not full capacity in terms of staff, although that's going to change over the next few weeks. Or you can contact the GEM, the General Inquiry Management Team, and all the details should be on the website to get through that. Through to there. So next, so we've got a patient sent a question in saying that they're recovering from COVID-19. Advice be different for them. So, well, we're ashamed we've not got Mark here to talk about the medical aspects of that, but I do know that our clinicians and our nurses will be making assessments, and they will need to be sure that you're fully recovered, in good health, and we won't be putting you under any particular extra risk in having treatment. So again, it will be a case-by-case basis, but there's no rules or guidelines to say if you're recovering, then we need to wait a particular number of months or weeks. It will be on an individual assessment basis, possibly with contact through your GP to make sure that you are considered to be fully recovered. Intralipids and steroids. So the immune therapy treatments are unlikely to be proceeding at this time because of the pandemic, because there's an immunosuppression aspect to some of the treatments. Those ones will be on hold for the time being, but your doctors and nurses at care will be able to talk to you a little bit more about that. I'm just looking for some more questions here. There's so many. What I do know that we will go back afterwards and we'll check all the questions and we'll respond to you individually if we can get through a message through, just to help you with your individual queries, because we can't clearly answer them all. Let's see. So we've got donor sperm, we've talked about that. So loads of questions about medicines, prescriptions. So you need to talk to your clinic about this. Some of you will maybe already have your protocol or your prescription, and you may be able to get those now ready for treatment. If you look on the website, our Care Fertility website, there is a checklist which is very helpful, which gives you all the things that you can be doing now to get yourself prepared for your treatment. I'll talk to you a little bit about some of the things that we're going to be doing in the lab that differ. So your embryologists will be wearing masks. We always wear hats, theatre clothing and shoes, and we wear gloves for some particular treatments for egg collection and sperm preparation. But we'll also be wearing masks, especially when we're in close contact and talking to you if we need to be closer than 2 meters safe distance. We will be performing less observations of embryos. We've got a process that's been developing over the last 6 months, actually. Since we got some information from a conference, we've looked at our own data, and basically when your embryos are in standard incubation as opposed to time-lapse incubation, we're going to be performing less assessments of them. And this is not directly related to this pandemic. We were doing this anyway, but it actually sits really well with working practices and adapting and improving things during this time, so that there'll be less handling of the dishes, less interruptions in the culture system. So the dish containing your embryos will remain in the incubator for the whole period, and we won't be taking it out every day to check on it. We'll of course need to check the fertilization, and then we'll leave them for several days to develop before we check them and schedule the embryo transfer. So we call this do not disturb. And we've learnt so much from our time-lapse imaging to understand that making these daily observations can add just a little bit of value, and actually the benefits of leaving them undisturbed may be much greater than taking them out regularly for assessments. So it'll be quite different for patients who've had treatments in the past and may have been used to daily updates. But we've got lots of information, and our embryologist will talk to you about why and how we're going to be doing that. Just looking at some more questions here. When will we be able to take on new patients? So we are still conducting new consultations. So our medical team and our nurses are available for initial consultations. So those for new patients as well as for review consultations. So we can take bookings now, and we can do them virtually. But online systems very well, slick, I was going to say, but it's not gone so well with Mark today with Instagram, but that may not be. I'm not entirely sure what's happened, but we can do that readily and effectively. So we can do new consultations straight away. I don't think there's a huge waiting list. So if you just contact your local clinic, they'll be able to book you in. So how will sperm retrieval be managed if your partner isn't able to be at the egg collection? So I think I mentioned that we're going to try and minimise the number of patient visits to the clinic. Of course, we're going to try and observe physical distancing, and any appointments and visits to the clinic that aren't absolutely essential, we will be trying to minimise those. Of course, it's essential during a treatment cycle, if we're using partner sperm, to get the sperm produced and receive it. So we've got two ways to do this. We can either do a sample production at home and drop it in to the clinic, or we can still bring the man into the clinic, into the room, and produce the sample like we would have previously, just with physical distancing measures in place, and spacing appointments out to minimise the number of patients and staff moving through the clinic at any one time. If you're having egg collection, then and you feel strongly you want your partner there, I can imagine that many people will, then we will try to accommodate that, of course. And after an egg collection, you can't drive anyway, so there will be someone coming to pick you up. So we will accommodate having a companion, a partner with you wherever possible for appointments that really need somebody with you. And certainly if the man's producing a sample, then he could do it at the same time. So we will just work with you to be as accommodating and safe as we possibly can. When will appointments open for consultations? We're open for consultations straight away. Can I start taking drugs? Not quite. No, please wait till we give you the green light when we've had our green light to proceed. Had IUI. Can we have another IUI? Yes. As soon as we have the authorization to proceed with treatment, then as far as we know, all treatments will be fine. We'll be doing individual assessments on patients to make sure you're in good health and ready to start the treatment. Staying safe and restarting treatment. So will we be advised once treatment has started to self-isolate strictly to ensure we stay healthy. We are going to undertake some testing, and so if we get a negative test from the antigen test to say that you do not have COVID-19, then you may decide then to self-isolate. It's up to you, but we won't be enforcing any rules, but you need to think carefully about keeping yourself safe during this very, very important time of your life, trying to have a baby. So we will give you advice as best we can on this, but it will be down to you to decide the measures that you're going to take personally when you're home in your own life. But we do have some very clear guidelines to help you make those decisions. The question then goes on to say, would we need to self-isolate potentially for 9 months? I don't think so. I'm not sure that's practical. But again, it's going to be entirely up to you. And we're going to keep an eye on the government guidance, the Royal College of Obs and Gynae guidance. We've got lots of professional bodies and authorities that can help advise on how we need to keep safe at this time, and particularly during fertility treatment, and then hopefully during pregnancy. So many questions here. Right, so what we've got a message here to say Mark's keen to answer some of the medical questions. So if I finish, we can then bring Mark on. That would be a good idea. So if I say goodbye, and then Mark can go live on this same account, and then he'll be able to answer some of the medical questions. And then hopefully that will work out pretty well. Not exactly what we had in mind, but I hope I've been able to help you and answer some of the questions. So just as a recap, please see the website for that checklist to help you get treatment ready. Contact your local care clinic or the general management inquiry line, and we'll be able to divert the calls to get you booked in for a consultation if you're a new patient. We'll be sending out lots of information through our patient portal, also on our website, which will help you understand when our doors are open and what you need to do next. We do anticipate this will be quite quickly, so we have already applied for our licenses to reopen. So I'm going to say goodbye now, and hopefully if you watch this space, Mark will appear very shortly. Thanks very much. Bye.